Below are things that can cause pain on the right lower abdomen. 1. Pregnancy that has implanted itself outside the uterus. Also known as ectopic pregnancy. After a sperm and an ovum have fertilized, it is supposed to move from the fallopian tube where fertilization occurred to the uterus for implantation. Women who do strenuous exercise, smoke cigarettes, older women, those who started sex at early age, those with multiple sex partners, those with pelvic infection or those that have undergone pelvic surgery are at risk of developing ectopic pregnancy. In most cases ectopic occurs when there is a defect in function and structure of the female sex organs. 2. Infection of the fallopian tube. Infection of fallopian tube by bacteria or virus that has traveled from the vagina, adjacent structures or through blood can cause inflammation of fallopian tube resulting in pain. Common in people with multiple sexual partners and in the youngs because of risky sexual behavior. 3. Obstruction of blood supply to organs on the affected side. In case of compression of blood vessel by adjacent structures, blood fails to reach adequately to the required organs. This mostly affects the cecum. Decreased blood supply results in necrosis. 4. Obstruction of the appendix. Normally the appendix is on the right side. Obstruction results in pain on the right side. Fecalith, food residue, tumors and even worms are the common cause of appendix lumen obstruction. Due to obstruction, bacteria grows, pressure increases and the appendix distends. This interferes with blood flow and lymph flow to the appendix. Inflammation occurs, and perforation can occur if not managed earlier. 5. Inflammation of colon, a disease that causes formation of ulcer on the mucosal wall of the colon. The colon will bleed and even swell. Apart from inflammation of colon, inflammation in the small intestine can also present with pain on that area. This condition mostly affects people in their 20s, 30s, 40s, 70s and 90s. Use of antibiotics at early stages of life increases the risk of this condition. 6. Due to crystallization a stone can form in the kidney. When the stone moves into the ureter extreme pain is felt by the patient. It can be on the low back or lower abdomen. Poor lifestyle, genetics, low urine and high urine calcium, increases the risk of developing a kidney stone. 7. When a part of small intestine penetrates a layer of abdominal wall where there is a weakness. The penetrated part of small intestine causes obstruction. Strangulation can occur, causing pain. Thanks so much for watching my video. Make sure to like, subscribe and share.